This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson, Sarah Giosi with you. And joining us in studio today is Dr. Alexander Nagy, the cardiothoracic surgeon or eighth cardiothoracic surgeon at Mon Health Medical Center. Also the medical director of cardiac and thoracic surgery. Good morning, Dr. Nagy.
Good morning.
How are you?
Doing well.
Doing well. And good morning to Sarah. I neglected to say good morning to you.
Good morning, Dave.
I always forget to say good morning to you.
No, it's fine.
That's
They
because-
just assume that I'm here and that, things are good. So we're fine.
Well, take a wild guess here what we'll be talking about today.
Hearts
Yes, and lungs.
and lungs.
Yes, that would be cardiothoracic, as I'm told by our great research
Yeah,
department.
of course.
But first, let's get to know Dr. Nagy a little bit, because if somebody's going to be working on your heart and lungs, you want to know who they are, right?
Well, of course.
Have you seen the commercial where the doctor comes in and the nurse, and they're going through the surgery, and they say, "How is this guy?" He's okay. have you seen that one? No, you don't watch television. Dr. Nagy, he's okay. I kid. Well, Dr. Nagy, good morning, and let's just start. Where do you come from, first of all? How did you end up in Morgantown?
Yeah, I grew up in Romania, actually in a specific part of Romania, maybe better known, so-called Transylvania, at least well known by children.
Yeah,
we've heard of it.
Yeah. However, we're not vampires, not all of us. Yeah. Then I did part of my medical school there. I went for my residency in France. I worked with one of the outstanding surgeons in France. And then I moved in the United States in the mid-90s, and I started my residency all over again in the Mount Sinai system in New York City. So I lived in mid-Manhattan for 8-9 years.
When did you know that you wanted to go into medicine?
Yeah. Well, I kind of figured it out pretty early, and my father was a kind of old-fashioned family doctor who went to patients' houses. They treat them there. The hospital availability was limited, so he kind of knew everybody from grandparents to babies. So I watched him, and especially I think I learned pretty early the importance of trust and care between the patient and the doctor. So that relationship, I realized very early that's important. Somehow later, a little bit, kind of in high school, I kind of revisited that relationship of patients-doctor from the different standpoint, because my mother became sick in her mid-30s with a rare form of heart disease called primary pulmonary hypertension. So I saw all the stages and symptoms of heart failure in my own house. She passed away at 41, but so that was my first lesson of medicine before medical school.
That's such a sad story,
Yeah.
but what a connection it can help you have with patients who are going through something as far as empathy and understanding some of the emotions to it. Do you think that's true? Just having experienced that yourself firsthand?
Absolutely. That was my very first lesson about medicine,
Yeah.
and mainly the most significant. And was another little influential factor that kind of directed me, not specifically for this particular specialty. When I was around 14 years old or so, I read a book. It's called One Life. It was written by Chris Barnard, who performed the first heart transplantation in Cape Town, South Africa. So I read this book several times. I said, wow, that's really cool. There was no heart surgeon in Romania at that time. And interestingly, later, several years later, the same surgeon kind of decided to sponsor a new heart surgery program at the same medical school where my father graduated from. And I was planning to go there. So forward a few years, I got in med school, and actually I had the opportunity to scrub. Scrub means assist in an operation with Maurice Barnard, who was Chris Barnard's younger brother.
Huh.
He continued the legacy of Chris Barnard. So that was very influential for me for some reason.
So kind of meant to be.
Yeah.
You know?
Yeah.
It sounds like it.
Before we get to the break,
Yeah.
what about family? Wife, kids?
Yeah, 4 kids, 4 little kids, a daughter in Canada. Family is okay, and obviously is a big part of my life. I see them a little bit less than I see my patients or,
Right.
or the staff, but the little I see them, it's very comforting.
Coming up, we're actually going to get into the actual focus of the show, cardiothoracic surgery. What is it? What are the differences? Who are candidates? We're going to get into all that as the show unfolds today. You're listening to Mon Health Talk Radio on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Mon Health Talk, Dave and Sarah in the studio, being joined by Dr. Alex Nagy, cardiothoracic surgeon at Mon Health Medical Center and medical director of the Cardiac and Thoracic Surgery.
Why don't we start from the beginning? Very good place to start.
Always.
And just tell everybody, what is cardiothoracic surgery? It's a very big word. Help us understand more simply what that means.
It's a big word. Basically, cardiothoracic surgery deals with the surgical treatment of the organs in the chest, mainly the heart and the lungs, as well as the great vessel, especially the aorta. I know that February is the Heart Awareness Month, so maybe we'll focus on the heart. I just want to make 2 little statements about, let's say, the lungs and why lung is very important. Lung cancer is still the #1 cause of death. No, the #1 cause of cancer death in both men and women. And why is such a bad player? Not because it's such a bad disease, but it's diagnosed very late. Patients usually have no symptoms on the initial stages, on stage 1 and stage 2. So the majority of them are diagnosed on stage 3 and stage 4 when surgery is not an option anymore. So what can we do about that? Patients who are 60, 65 with a long history of smoking, with a family history of lung disease, lung cancer, probably should have what's called a low-dose CT scan of the chest, which is a very easy test, and with the accuracy of diagnosis is very high. A simple chest X-ray might not be enough because it can miss many lung cancers. Patients who are diagnosed on early stages, usually they have very good outcomes.
So
Let me just give a really quick personal endorsement on
Go
this.
for it.
And nobody asked me to do this, but my grandmother was a woman of the 50s where smoking was just what you did. And she had quit after, not too terribly long, but she did end up having lung cancer. You were her physician. You may not remember that, but you changed her life, and she had nothing but most amazing things to say about you. And I'll be honest, she doesn't always say the most amazing things about everybody.
That's true.
So I just want to throw that out there and say thank you. I think that you're right. It is so important, and it's something we talked about this. I think, was it just last week, Dave? We talked a little bit about lung cancer in our state, whether it be because of smoking habits or even things like black lung and things that have really impacted our people. It's so important here and so relevant everywhere, but in the state of West Virginia. So just wanted to echo that. There you go.
How do you determine if you're seeing a patient, you deal with heart and lungs, how do you determine if it's you who will be operating or if it's going to be a cardiologist or someone else if we come in? Does it depend on the disease, depend on the situation?
Well, if it's a surgical, if surgery is the best treatment, usually I'm involved. There is one particular procedure that kind of was a game changer, I would say a paradigm shift, that brought us together meaning interventional cardiologists, imaging cardiologists, and cardiac surgeons, and that was the transcatheter aortic valve replacement. Actually, MAN was the first medical center in this region that performed the first so-called, the abbreviation is the TAVR procedure, transcatheter aortic valve replacement. This was in November 2013. And currently we are doing 2-3 cases each week. And that's this particular procedure really created one team between surgeons and cardiologists.
Can you explain what you did in that procedure?
Yeah. So this procedure is geared especially for patients who have severe aortic stenosis, so a severe narrowing of the aortic valve, and usually they are high risk for open heart surgery. Let's say patients in their 80s, or we've done patients in their 90s. So that aortic valve has to be either replaced or somehow a new valve has to be implanted. So basically what we are doing, we implant a new aortic valve going through the groin all the way up into the heart and deploy that particular valve using a balloon, something like the way you open an umbrella. Is a minimally invasive procedure, is very well tolerated. Currently at MAN, this procedure is done percutaneously. That means there are no cuts. And the patient is usually discharged the very next day.
You can replace an aortic valve and discharge the patient the next day?
Correct, yeah. Replace
So
the
wild.
aortic valve. It
With
was,
no cuts.
Yeah.
There's no cuts. That's what I said. This was a game changer. And that becomes now the gold standard for what we call minimally invasive procedure.
And you think, and we say this on the show time and time again, Sarah, when we're talking about MAN Health, you think, oh, I've got to go to Cleveland, I've got to go to Baltimore to have these procedures done, I've got to go to Pittsburgh. We're doing these right here in Morgantown, and that's amazing to me.
Yeah. I think we are a community hospital with an outstanding cardiac program. Probably short of heart transplantation, we offer everything here. So there's no need to go out of state.
We're just so lucky. And to have all of this, I mean, all of this groundbreaking procedures readily available. And like you said, Dave, I mean, you could have somebody that's a loved one or yourself that's hurting, and you can walk right up to the hospital, walk right in, go and have an appointment. I mean, it's just wild.
Apparently, you can walk right back out the next
The
day.
next
too.
day. I mean, that's crazy.
Before we hit this break, I want to ask you about, you presented a case in Morocco, in Monte Carlo.
Monte Carlo.
I'd love to, by the way,
Carlo.
visit there, Monte Carlo. But it was about the custom core matrix valve. Now, what are we talking about here?
There was a unique procedure. This patient was like 34 or so, mother of 2 little kids. Had a prior open heart surgery in a different center, which when she barely survived. 1 year later, she came back to us again with an infection of that particular valve. So we realized that we have to be somehow creative. We cannot just replace that valve, which probably is going to be infected again. So we create a so-called like a homemade valve, actually, which was made in the operating room by our team. We implanted the valve to replace the tricuspid valve. This core matrix basically is a bioscaffold that allows native cells eventually to migrate and recreate a functional valve. The bottom line is that we published, actually we presented this paper in Monte Carlo, was very, very well received. There was a lot of interest about that. And more importantly, the patient is alive and well 2 years later.
Did you catch that, Sarah? Just a homemade valve.
Yeah, I know. I was picturing like paper mache, or but obviously,
Yeah, we'll just
I
make
mean,
a valve.
Yeah.
And
Why
again,
not?
it's one of those things about having an organization that supports things like that and being able to try new things. It's wild.
We'll continue the conversation. Got to squeeze in one more break. We're talking to Dr. Alex Nagy, cardiothoracic surgeon at MAN Health Medical Center. Back after this.
Now back to MAN Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our MAN Health guests, call now 304-224-0214 296-0041.
Dr. Alex Nagy, cardiothoracic surgeon at Mon Health Medical Center, joining us in the studio this morning, Sarah.
Yes, and we only have a few minutes left, so I really want to just talk for a minute here about the importance. We've talked so much about high quality care at Mon Health, but why is that so important that we are able to provide that for patients here and in the surrounding area?
Well, that's very important to us. That's the best measurement of the quality of our work. And then I'm going to refer first to the most frequent operation we do, which is a coronary bypass. As we all know, coronary artery disease is the #1 cause of death in men and women. Approximately 400,000 people die of coronary artery disease each year. So coronary artery bypass represents the best surgical treatment for coronary artery disease. Basically, is a rerouting of the blood flow around the blocked vessel using arteries or vein. We perform at Mon approximately between 200 and 300 of coronary bypass procedures. We are very careful and individualize the treatment for every single patient. And I'm proud to report that our in-hospital mortality in 2017 was 0, in 2018 was below 1%, and in 2019 so far is 0. These outcomes are significantly better than the national averages and are at least at the same level with nationally recognized medical centers.
So you kind of spoke sort of humbly about it, but the fact of the matter is high quality care is so important because it changes the death rate. I mean, it's so important because you have people that are surviving that otherwise perhaps wouldn't. So,
because many times when I talk to patients before the operation, they ask me, so what's my chance? 50%, 40%? So usually my answer is 99%.
yeah.
And I can see that's very unexpected because the perception still is that open heart surgery is something very, very risky. But when you look at the outcomes, it is really a very safe operation. Even if I move from the coronary bypass to surgical aortic valve replacements, I'm not talking about TAVRs, we report our outcomes to a national database, which is the largest national database in the country. And they look back at 3 years. Our mortality with aortic valve replacement is still 0.
Dr. Alex Nagy, cardiothoracic surgeon at Mon Health Medical Center. We're all out of time, believe it or not. So I will end the show the same way I started. Dr. Nagy, he's okay.
How about learn more at monhealth.com?
That's right. Hey, thanks for stopping by this morning.
Thanks for
Appreciate
having
it.
me. Yeah.
All right, we got the news coming up next. Thanks for listening. Mon Health Talk here on WAJR.